Director of the 5th Avenue Dermatology, Surgery, and Laser Center. Today in my educational video, we're going to be talking about tumescent liposuction, which really means removing fat under local anesthesia. This is a procedure that's been around for several decades. I've been performing it in my office for about 15 years, and we've done almost 3,000 cases here in my accredited surgical facility. This is a safe, effective procedure that takes inches off of any area of the body, wherever you have fat, all with a simple recovery of 24 to 48 hours. Now today I'm going to perform a procedure on a young woman's abdomen and love handles. She's had a few babies and these areas are resistant to diet and exercise for her. I'm going to be using a technology called the Vaser, which is an ultrasonic technology that helps melt the fat prior to removal. So in a few minutes we're going to come back and we're going to go over the step-by-step progression on how we do this procedure in our office. See you soon. So now we're here at pre-op. Our patient, we're treating the abdomen area. I'm going to do a small drawing just to give the basic outline of the area. Okay, it's mostly the belly. I'm going to do a little bit, turn this way. A little bit on the love handle, the back area is fine. The holes are very small. We're going to be doing everything through something much smaller than a Heaven eraser. There'll probably be about 5 teeny ones that will close up without stitches. She's going to get a shot of low-dose Demerol and Valium so she's nice and relaxed. And what we're going to do is, in the next video, we're going to fill this area up with local anesthesia. It's very much like going to the dentist. The only part of the procedure you feel is the shots, but it goes very quick. She'll be mildly sedated, and she'll do quite well. And we're going to see a dramatic difference in only a few hours. Hi, I'm Dr. Frank, and we're back in the OR to do some tumescent liposuction. Let's go down to the area. The patient that we saw before, we're going to do her belly and love handles. The area is prepped, it's drawn out. I've made 3 very teeny holes that will close up without stitches here. Okay, and what I'm going to do is I'm going to take this thin instrument with the local anesthesia and I'm going to infuse it through remote control through a little pump. And we're doing that right now. And just like filling up a balloon, I'm putting in the fluid. This part does sting a little bit, there's a lot of dripping, there's no bleeding. And after about a minute or 2 in each area, she will get numb. What we're doing is we're swelling up the area, separating the fat from the muscle and the skin. So this will take about, 5 minutes in the belly. She's sedated on a little Demerol and Valium, so she's kept quite comfortable, but is awake if I need her to be woken up. And that's the anesthesia part. Okay, so the patient is 100% anesthetized right now. The area is tumesced. The skin looks a little white from the anesthesia. And what I'm going to do first before I remove the fat is I'm going to melt it. There are several different devices that can be used. Sometimes I use Smart Lipo, which is a laser. This is the Vaser device, which I'm using an ultrasonic wand to melt the fat. It will also help tighten the skin from underneath. There are other devices too, like powered liposuction, but the key is that it's all done under local anesthesia with very thin instruments. So I'm going to have my assistant put some water to protect the skin, and it's going to cut off my voice from the sound of the ultrasound. Here we go. So we do that for a few minutes. Once the fat's all melted, we'll take you to the next stage in which we extract the fat itself. Okay, so now we've melted the fat already. It's all liquefied. And now I'm going to take a very small micro cannula. I'll take a few different shaped ones and go around. And we will just gently extract the fat. Okay? I don't have to be too aggressive. And we'll slowly see over the next 15 minutes to a half hour, it deflates. And the fat's coming out beautifully. And the patient has no bruising, no bleeding, and this is the way the procedure is done. And then we'll see her in post-op. Okay, so the procedure is over. You're not going to see much of a huge result right now, but it's much flatter than what it was when it was all swollen with anesthesia. The holes are very small. They're going to close up without any problem in a couple of weeks. The most important thing is that the patient doesn't have any significant bruising or swelling. In fact, there's not going to be a bruise on her. We're going to put little bandages on the holes, an absorbent pad over the affected areas, and then like a binder, like a weight belt binder that she'll wear for a few days. She'll be able to take a shower tomorrow, go back to work in 36 hours, and really be in no post-op pain that would require any type of prescription medication. Tylenol is really more